My name is Emily and I'll be your student nurse today. I'm going to be conducting a head-to-toe assessment on you and I'll have to touch you. Do I have your permission?
Yes.
Okay, I'll provide patient privacy and perform hand hygiene. Can I check your wristband, please? Okay, and can you tell me your name, your age, and your date of birth?
Ava, my age is 10 and my date of birth is December 30th, 09.
Okay, can you tell me the date today?
November 27th.
And where you're at?
My house.
Okay, patient is alert and oriented ×3. Can you wiggle your fingers for me? Patient scored a 15 out of 15 on the Glasgow Coma scale. Patient is comfortably erect, clean and kempt. Arms are relaxed at the sides. Facial expressions are relaxed. Patient appears to be stated age and seems willing to cooperate. So first what I'm going to do is your cranial nerves. I'm just going to have you close your eyes. I'm going to place something under your nose and I want you to tell me what you smell.
Alcohol.
Okay, cranial nerve 1 is intact. And for cranial nerve 2, I'm just going to have you cover one eye and I want you to tell me whenever my finger comes into view.
No.
Now do the other eye.
No.
Okay, cranial nerve 2 is intact. Now I'm going to look into your eyes with my pen light. Just look straight at the wall. Okay, pupils started at a 4, constricted to a 2. Now I want you to follow my pen light with your eyes. Don't move your head. Now follow my pen light into your nose and back out. Okay, pupils are equal, round, reactive to light and accommodation, and cranial nerves 3, 4, and 6 are intact. Now I'm just going to take a cotton ball and I'm going to place it on your face. I want you to close your eyes and tell me whenever you feel the cotton ball.
No. 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 No.
Okay. Now just bite down for me. Cranial nerve 5 is intact, and for cranial nerve 7, I want you to take a small bite of this for me and tell me what you taste.
It's sweet.
Okay. Now, can you raise your eyebrows and puff out your cheeks? Okay, cranial nerve 7 is intact. For cranial nerve 8, I'm going to do the whisper test. So I'm just going to have you plug one ear and I'm going to whisper 3 items into your other ear and I want you to tell me what I said, okay?
1, 2, 3.
And I want you to do the other ear.
ABC.
Okay, cranial nerve 8 is intact. Now I just want you to open your mouth, stick your tongue out and say ah. Okay, soft palate and uvula rise midline and tonsils move in medially whenever the patient says ah. So cranial nerves 9 and 10 are intact. For cranial nerve 11, I just want you to shrug your shoulders against my hands. Cranial nerve 11 is intact. For cranial nerve 12, I want you to stick out your tongue. Move it side to side. Okay, now say light, tight, dynamite.
Light, tight, dynamite.
Okay, cranial nerve 12 is intact. Now I'm going to move on to your hair, skin, and nails. The hair is soft, shiny, no manifestations present. I'm going to palpate for skin temperature. Skin is warm, pink, dry, smooth. Let me see your nails like this. There's no signs of clubbing. I'm just going to check skin turgor. Skin turgor is elastic bilaterally, and capillary refill is less than 2 seconds bilaterally. Now I'm going to move on to your head and face. The head is normocephalic, round and symmetric. The face is also round and symmetric. So I'm just going to palpate your temporal arteries. Temporal arteries are palpable and +2 bilaterally. Now I'm going to auscultate. Okay, no bruise noted on either side. Now I'm just going to take my pen light and look at your eyes. Just look straight ahead. Conjunctiva is clear, moist, and rounded. There's no redness or drainage noted on the outside of the eyes. The eyes are symmetric. And the nose is midline and proportionate to the rest of the face. Any pain or tenderness?
No.
Okay. Now I'm just going to look inside of your nose. No polyps or obstructions noted. I'm going to palpate your sinuses, and I just want you to tell me if you have any pain or tenderness.
No.
Okay, now I'm going to palpate your lymph nodes. Preauricular, postauricular, occipital, submandibular, submental, jugulo-digastric, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Any pain or tenderness upon palpation?
No.
Okay, good. Now I'm going to palpate your carotid arteries. Carotid arteries palpable and +2 bilaterally. Now I'm going to auscultate. Okay, no bruise noted. Now I'm just going to look at your mouth. Your lips are pink and moist with no cracks. I'm going to have you stick out your tongue and open your mouth. Buccal mucosa and soft palate are pink and moist. Can you smile for me? Teeth are white and free of debris. Gums are pink and free of bleeding. And there are a few missing teeth in the front and the back. Now I'm just going to look at your ears. Ears are symmetric and proportionate to the face. There is no redness or drainage. No lumps or lesions noted. Did you have any pain or tenderness?
No.
Okay, and if I had an otoscope, I would look inside your ears, and your tympanic membrane would be pearly gray, and the cone of light would be present at 5 o'clock on the right ear and 7 o'clock on the left ear. And I would use my ophthalmoscope to look at your red reflex in your eyes, and the red reflex will be present bilaterally. So now I'm just going to move on to your neck. I'm going to palpate your trachea. Trachea is midline. Did you have any pain or tenderness?
No.
Okay, I already palpated your lymph nodes. There was no pain or tenderness there. Now I'm going to test range of motion. So just do what I do. Back, forward, side, side, all the way around. Okay, now push your head against my hand and the other side. Patient has full range of motion of the neck and +5 muscle strength. Now I'm going to move on to the chest. So first what I'm going to do is I'm just going to palpate for any tenderness. You tell me if you have any, okay? Any pain or tenderness?
No.
Okay, now I'm going to move on to the back. Any pain or tenderness?
Nope.
Okay, and while I'm back here, I'm going to palpate your thyroid gland. So just look to one side for me. Look to one side. Swallow. Okay, and then look to the other side. Swallow again. Thyroid gland is non-palpable, and now I'm going to check for JVD. So I'm just going to have you look to that side again with your whole neck. No pulsations noted on that side. Now look to this side. I'm going to do the same thing. No pulsations noted, so patient does not show any signs of JVD. Now I am going to auscultate your lung sounds. And I want you to just take a deep breath in and out every time you feel my stethoscope on your chest. I'm going to do the same thing to your back. Just take a deep breath in and out every time you feel my stethoscope. Okay, breath sounds are clear and equal. I'm just going to check for symmetry. So just breathe in and out for me. In and out again. Okay, anterior and posterior thorax are equal. There is a 2-to-1 AP to transverse ratio of the chest. The breaths and the chest look equal. Symmetric. Okay, now what I'm going to have you do is I'm going to percuss. And I'm just going to tap lightly on your chest. Now I'm going to do the back. Okay, resonance was heard all over all lung fields. Now what I'm going to have you do is I'm going to have you lay back and move to the edge of the bed for me. And I'm going to listen to your heart sounds first. I'm going to palpate for the apical pulse. And now I'm going to auscultate for 1 full minute. Okay, your apical pulse was 75 and the rate and rhythm was steady. Now I'm going to auscultate your arteries. Aortic, pulmonic, tricuspid, mitral. Now what I'm going to do is I'm going to listen to your aorta, and then I'm going to move on to your abdominal and your bowel sounds, okay? Listening to your aorta. Now I'm just going to move on to your bowel sounds. I'm going to lift your shirt up. Okay, bowel sounds present and active in all 4 quadrants. Now I'm just going to percuss. Okay, tympany heard in all 4 quadrants and dullness heard over the liver. Now I'm just going to palpate, and I want you to tell me if you have any pain or tenderness.
Nope.
Okay, now I'm going to do deep palpation. Just tell me if you have any pain or tenderness.
Nope.
Okay, and the abdomen is flat and symmetric. Now you can sit back up for me and scoot back to the edge of the bed. Now I'm going to do your upper extremities. I'm going to check for skin temperature. Skin is warm, pink, smooth, hair is absent, skin turgor is elastic. I'm going to palpate your radial pulses. And now your brachial pulses. Radial and brachial pulses are both palpable and +2 bilaterally. Now I'm going to do range of motion of your arm, so just do what I'll do. And all the way around. And now can you just roll your wrist all the way around? Okay, now cross your arms like this and just squeeze my fingers. Okay, patient has full range of motion of the arms and a +5 muscle strength bilaterally. And now I'm going to move on to the lower extremities. I'm going to check for skin temperature. Skin is smooth, pink, hair is absent. Now I'm going to check your capillary refill on your toes. Capillary refill is less than 2 seconds bilaterally. Now I'm just going to check your pulses. Popliteal, posterior tibial, and dorsalis pedis. All pulses are +2 bilaterally. Now what I'm going to do is I'm just going to check your Babinski reflex. So I'm just going to take my pin light and I'm just going to move it in a J motion on the bottom of your foot. Patient has a negative Babinski reflex. Okay, now I'm going to have you stand up. And we're going to do range of motion of your legs. So just do what I do. Forward, back, to the side, and all the way around. Okay, forward, back, to the side, and all the way around. Okay, good. Now sit back down. And I want you to push your feet up on my hands and then down. Patient has full range of motion of the legs and +5 muscle strength bilaterally. And now what we're going to do is we're going to move on to neuro. So I'm going to have you close your eyes. And I'm going to place an object in your hand, and I want you to tell me what it is, okay?
A pen.
Yes. Now, I just want you to touch one finger to your nose and move back and forth and get faster. Okay, patient has positive cerebellar function in the upper extremities. Now, I just want you to take your heel and slide it all the way down your shin. Now the other side. Patient has positive cerebellar function in the lower extremities. Now what I would do is I would test your deep tendon reflexes with a reflex hammer. So I'll just lightly tap your knees right here, and your leg would gently just move forward. And so now I'm going to have you stand up for me again. And turn this way and close your eyes. And I'm just going to move my hands out straight and you just stand with your feet together. Okay, you're done. Patient has a negative Romberg test. And now turn around and I want you to stand on one leg and do a deep knee bend for me. Now the other leg. Okay, patient has good muscle strength and balance. Now what I want you to do is I want you to start at this wall right here. And I want you to walk to that wall, heel to toe, and then walk back normally. Okay, patient has a steady and balanced gait. Now we're gonna do your range of motion of your spine. So I want you to do what I do. Just go back, side, side, and forward. Okay, patient has a full range of motion of the spine. Now just turn around and touch your toes, and I'm gonna check for scoliosis. Patient has a natural curve of the spine with no signs of scoliosis. Okay, you can sit back down for me. And I want you to close your eyes. I'm going to check for kinesthesia, and I'm going to move your fingers up and down, and I want you to tell me which is which, okay?
Up, down, up, 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 down, down, up.
Okay, kinesthesia is present. Okay, now I forgot to do tactile fremitus whenever you're on your chest, so I'm just going to do that now. I'm just going to touch your chest and your back like this, and every time I do, just say 99.
99, 99, 99, 99, 99.
Now I'm going to move on to your back.
99, 99, 99, 99, 99, 99.
Okay, tactile fremitus is even, present. Now I'm going to palpate your epitrochlear lymph nodes on your arms because I also forgot to do that. Any pain or tenderness?
Nope.
Okay. And I believe that will conclude our assessment today.